The point of today's video is to discuss TMJ pain. Now, what is that exactly? Well, the TMJ is the temporomandibular joint, which is this joint right here. And what happens is, when the mouth opens and closes, it's pivoting at the TMJ, which is the temporomandibular joint. And people usually refer to pain in this area as TMJ pain, or it could be TMJ disorder, which is temporomandibular joint disorder, or some people just refer to it as TMD, which is temporomandibular disorder. It's all the same thing. Now, what can vary is exactly what is causing the pain in and around the TMJ. So that's what we're going to discuss today. So back on this board over here, I have some of the major causes of pain. And we'll begin by going into the muscles of the temporomandibular joint. And the first one we'll look at is the temporalis. So the temporalis is situated right on the side of the skull, and it goes all the way down to the jaw, so that when it opens, this muscle here stretches because it's connected to the jaw. So when it's open, this muscle is getting a deep stretch, and when it closes, it's pulling. So the next muscle we're going to talk about is the masseter. So the masseter is right here on the side of the face. It goes from the cheekbone down to the bottom of the jaw. And when it opens, the jaw opens, it stretches that muscle. And when the jaw wants to close, that muscle tightens up and pulls the jaw shut. It tightens up just like that. Now, what causes problems is when these muscles get restricted, when they get spasms or adhesions in them. Because what happens is then, every time you open your mouth, they're really, really tight. They're just fighting you the whole time. So you're trying to open, and they're not letting you open all the way. Same thing with this muscle. Now, what can happen is the muscles on one side of the jaw can be tighter than the muscles on the other side of the jaw. So if this masseter here is tight, and this one here is not so tight, when you open up, it's going to naturally, because this is so tight, pull the jaw to the tight side. So you may open your mouth, and you may see that as you open, it starts moving toward the left side. You'll see the jaw opening up a little unevenly. It'll look something like this. And that usually means that there's something asymmetrical going on. Something on one side is tighter than something on the other side. Or maybe you're having a disc issue on one side versus another, which we'll go into. Some of the reasons why these muscles could be tight is from teeth grinding. So think about it. If you're always grinding your teeth and just jamming them against each other, what's causing the jaw to shut and clench like that? Well, these muscles. And when they get too tight or they're clenching for too long, that's when restriction sets in there. The other thing that can happen is, it could be something incidental, like maybe sleeping on one side or impact to one side. That can cause a disruption in normal muscle function, but that's not as common. What also can happen is that if you can't open your mouth all the way for some other reason, could be a disc issue, capsule issue, we'll go into that, but let's just say you can't open your mouth all the way for whatever reason. That means that these muscles, which stretch out when you open your mouth nice and wide, they never get stretched out. They're always tight because you're never opening. And so, as a result, it causes the spasms and restrictions in there, and then it gets even more difficult to open because now these muscles are tight on top of whatever the initial problem was. So now let's take a look at what a disc issue actually is. So you could see in this drawing, I drew the disc. It kind of looks like a peanut. It's biconcave, meaning that the center part arches in from the top and the bottom. And I made this fancy prop for the demonstration. So what happens is, when you open your jaw, it doesn't just go straight back, or that would look really weird if your jaw just dropped all the way back like that. So as it opens, it also slides forward, and then it slides back. So it opens and slides forward and slides back. And what happens is there's a disc. The disc sits right there in the joint. And so as you open and it kind of slides forward, the disc moves like that. So the skinny concave part, biconcave part, always stays above this part of the mandible, of the jaw. What happens is sometimes, you may have heard of anterior displacement. What happens is this disc may shift forward and it gets stuck there. So someone's mouth can actually get stuck open or closed depending on how it gets wedged. Or as you open it, it gets stuck forward, it clicks, and then when you close it, it clicks back into place. It could be, and it could go medial, lateral, all different directions. But basically, a disc issue is when the disc is not in the proper place. And if that happens, and you can't open your mouth all the way as a result, that's when all of those muscle issues add on top of it, as we discussed before. And another thing that can happen is the capsule can get tight. So the capsule, I drew an arrow from there because it covers the joint. A capsule is basically ligament structure that holds two bones together. So where this bone and this bone meet each other, there's ligaments. Oh, I forgot, I have a little prop for that too. This little yellow band. So that goes right over the top here, like that, and it holds it together. Now, it's supposed to be loose enough to allow you to move, but if it gets really, really tight and holds on tight, there's restriction as you're trying to move through, and it makes it difficult to open your mouth. And again, that can contribute to additional spasms here. How does posture fit into the equation? Well, what's classic bad posture? Forward chest and head like this, right? Look at when I stand up straight, how stretched out the back of my neck is. And when I'm forward, how compressed and tight it is. This compression can cause headaches or neck pain and irritation. And when you have headaches, neck pain, irritation, what do people tend to do? They get stressed, and that can cause more grinding or more pressure in the muscles, making TMJ even worse. The other thing that can happen is, if you try to open and close your jaw in a good posture, there's not much resistance at all. But try it at home. When you go forward and try to close, right at the end, you feel resistance. Like there's pulling from these muscles. And that's because they are lengthened. They're pulled all the way forward. And when you bite up, they're tugging against you. They're fighting against you. So that makes these muscles and these muscles work overtime to fight against that and pull up. It also makes the joint itself, the TMJ joint, having resistance from different directions, moving in an abnormal direction, causing more irritation. So fixing your posture can also be key to removing and eliminating all your TMJ pain. So at this point, we've covered a bunch of the main players that cause TMJ pain and dysfunction. And if you're experiencing the pain, what you need to do is figure out what is the specific cause of it. Sure, you have pain, but if you don't know the root cause, then you can't fix it quickly or properly. So what I would advise to you is go out to a TMJ specialist, a physical therapist who treats this, and have them do an evaluation with you and give you the information that you need, where you can continue with treatment and rid yourself of the pain. Now, there's going to be a second video to this series where we're going to go into some tips to address these. Thank you. That was a smooth ending to my video.